Hi there, welcome to this week's Ask Amy. I had a phone call this week from a doctor who had a planning appointment coming up and that afternoon, and he was a little stumped as to how to handle it. And I love, first of all, the fact that he called me and had a specific concern and specific question with a specific patient that he wanted to talk about. And my hope is that you guys will do that. I'm here not just to Skype with you every other week, but I'm here to help you with these challenges as they arise. So I hope you'll take advantage of that, like this particular doctor did. We had a really good conversation. His question was, I have a planning appointment coming in today, and I'm not really sure what to do. And practice is fairly new in our program. There's been a little bit of limbo with the assistant role. And so he was looking to handle this planning appointment all on his own. And so the first question I asked is, did the patient go home with photos? And he said, well, no. In fact, I don't even think we took photos. And so, of course, my next question was, well, why didn't you take photos? So, that aside, the very first thing that I, suggested he do that particular afternoon is have photos taken. Okay, that's got to be first and foremost what you do. Now, the other thing that I suggested is, let the patient know, hey, because we're going to be sitting down today and coming up with a plan, your input is really important to us. So do you mind if we take some photographs really quick? And so, let the patient know why we're doing that, and it ties in with their wants and what's important to them. And then what I suggested he do is, while the team is getting those photos printed and uploaded and all that good stuff, sit down with the patient and just reestablish goals. It sounds like either they weren't established or not communicated or not recorded. And so, basically what I suggested to him is that he start from scratch. And to sit down with the patient and, say, before we get going today, I've looked over your x-rays. I know that you talked with us last time, and, this particular patient had one tooth that was an issue. He said, I know that that's of concern, but I'd like to know how else you'd like us to help you. So with your permission, is it okay if I ask you a few questions just to be sure that we meet your expectations? Okay, and so kind of set the stage, so to speak, let the patient know what conversation's about to happen, so we just don't come out of left field with, what goals do you have for your teeth? This is a conversation. It has to flow. It can't be segmented. And I think sometimes when we know we're supposed to ask open-ended questions, they're just thrown in at random times. And I want you to have or feel the freedom to use common sense and use your personality to allow this to flow. Okay, obviously there are objectives that we have, and that is number one, find out why the patient came to you, and number two, find out how the patient wants you to help them. And so, that's kind of the parameters I gave him, giving him the freedom within that to ask his own questions. And so while the photos are being developed, it's a great time to have that conversation and ask the patient, other than this one tooth that you came in for, tell me about the rest of your teeth. What if we were to find some things that could potentially put you in the same situation? How do you want to handle those things? Would you like our help with those things? What are your expectations over the next couple of years for your teeth? How important is prevention to you? If we see some things that aren't necessarily symptomatic, in other words, aren't hurting you today, you can't feel it, you can't see it, but could down the road cost you, extra money or unexpected visits to our office, is that something you'd like for us to help you with? Okay, tell me what's most important when you think about your teeth. How do you feel about the way your teeth look? If we could help you avoid pain, is that something you'd like our help with? So, again, I'm not suggesting you ask every single one of those questions verbatim. Those are just some that come to mind that I think when you're trying to understand the patient's motivation are great questions to ask. Now, on a scale of 1 to 10, tell me how you rate your mouth, just overall. We're not talking about smile necessarily. In fact, I think when you're having these conversations, start out with why the patient came in. Okay, you came in with this tooth, it's broken. Would you like us to help you prevent other broken teeth? Okay, start there. And then I think you ask a broader question. The scale of 1 to 10 question is great. What's most important to you? How do you want us to help you? And then let them go where they want to go. They may go to cosmetics. They may go to function. They may go to avoiding pain. They may go to, I hate the dentist and I don't want to be here. So wherever they go, follow them. And I promise you, if you are listening and engaged and sincerely on the same page, what they tell you will basically tell you what to say next. And so as I was talking with this doctor, first let's get the photos taken. Let's ask some questions to establish the patient's motivation, understand what's important to them, how they want you to help them. Are they wanting to look big picture preventive? What are they thinking? And at that point, then you kind of know where to go. Well, it sounds like, obviously you want us to take care of this tooth and that prevention's important to you. You came to the right place. I can do all of that for you. Would you like for me to sit down and come up with a long-range plan that includes all the things that you just shared with me are important to you? And then you can decide at what pace you want to go. Most patients like to just take care of it in a couple of well-planned visits, but really that's up to you. Okay, so that's sort of where we go with this. Now, honestly, that conversation should have happened at the initial visit. Okay, that's where photos should have been taken. That's where these questions should have been asked so we could set the doctor up for success. So that really all the doctor has to do is walk in after the assistant's role in that planning appointment, assuming photos were taken, and can carry on from there. So hope this was helpful to you. I think, again, when you don't know what to do, just ask some questions. Okay. Be okay with reestablishing those goals and getting back to the basics and just listen. Just listen. And I promise you it'll work out well. We'll talk to you next time. If you have any topics or any questions you'd like for me to cover, feel free to do that. I had a doctor say the other day that he just plugs this into his car on the way to work and listens to it. And I'm flattered. I'm not that entertaining. But if it helps you to be able to hear these questions or hear these thoughts or hear these concepts over and over, that might be an easy way to do it. You should be able to get these emails on your phone. Just click on the link and get the videos, and you don't have to see me. In fact, that's perfectly fine. I think if you just hear the content, that will accomplish what we want to accomplish. So let me know how I can support you in that. See you next time. Bye-bye.